There are some new concerns tonight over monkeypox. At least 5 children have now tested positive for the virus across the U.S. 2 of those cases in California, another 2 in Indiana, and officials say the 5th case involved an infant who is not from the U.S. but had been traveling through the Washington, D.C. area when they tested positive. I want to bring in Dr. Peter Hotez. He is with the Texas Children's Hospital, joining us tonight to talk more about monkeypox. Doctor, always good to see you. Appreciate you giving us some time tonight. Reviewing the CDC's guidance on this, they said that kids under the age of 8 are at a, quote, increased risk for developing a severe illness from monkeypox. Do we know why that age group is more vulnerable?
It's based on data coming out of both Central Africa and West Africa, because the mortality rate out of West Africa was described around 1%, somewhat higher in children. I think it has to do with the maturity of the immune system. We don't have a lot of details about it, but the point is, as the number of monkeypox cases continues to grow in the United States, over 6,000 reported cases, the real number is probably significantly higher. We should expect spillover from the current high-risk group into the general population if we allow those cases to continue to grow.
So are we adequately responding at a federal level and then state and local level to where we're seeing things right now? Because every morning I feel like we wake up and there's more new cases. Now we're seeing kids infected.
Yeah, it's a pretty steep trajectory, and the worry is that we just do not have the vaccine doses nor the doses of the medicine, the tecovirimat, also known as TPOXX. You know, there were a lot of lapses, unfortunately, in the federal government. We had 20 million doses, or a significant number of doses stockpiled of the vaccine. We allowed it to expire, and it wasn't replenished in time. This vaccine was approved in 2019. It was supported heavily by the U.S. government, and then we allowed the doses to expire. So it's a really difficult situation. Now we're trying to play catch up in order to acquire as many doses as we possibly can. The Biden administration is now, trying to work fast and furious on this. We have a new monkeypox coordinator and deputy coordinator, but we're not going to get the millions of doses that we need over the next few months to really quell this epidemic. So the question is, can we do more with the antiviral drug and use that as a form of post-exposure prophylaxis or a form of pre-exposure prophylaxis to make up the difference? So I think they're looking at all of those possibilities. And we also have shortages of diagnostic testing, and our healthcare system is not as set up as it should be. So once again, we're coming at this from behind, and it's too bad because unlike COVID-19, the vaccines were already invented and developed, and same with the antiviral drug. We just had too many lapses in our system.
It just doesn't seem like we should be in this position. Not only that, the vaccine, and correct me if I'm wrong, not approved for people under the age of 18, right? So the kids in the high-risk category still couldn't receive it.
Well, but for there, we could probably do some immunobridging studies, just like it was done with the COVID-19 vaccines for kids. So I'm not as worried about that, but it's a matter of having, if the doses of vaccine are just not there in the stockpile, then there's not a whole lot you can do other than try to hope that we can move as quickly as possible on that front.
Doctor, before I run out of time, I know monkeypox is spread in several different ways. How is it transmitted, and what's your message to the public on trying to prevent the spread and protect themselves right now?
There seem to be several different modes of transmission: respiratory droplet contact, somewhat similar to influenza, but also skin-to-skin contact, oral-to-skin contact. So it's close, fairly intimate contact. Most likely the kids that were infected is through household transmission. It's not as easy to spread as it is COVID-19, and you really do not have the problem of asymptomatic individuals. So in theory, it should be easier to do the contact tracing and control, but it would sure be a lot easier if we had all of the tools available right now.
Well, we're playing catch up. It's in almost every single state right now. Dr. Hotez, appreciate your time tonight. Thank you. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.